this video, we will be reviewing the different types of masks used for CPAP and BiPAP therapy. We will go over the different parts of the masks and how to adjust the mask to fit well. Please consult your healthcare team to see which mask is most appropriate for your child. There are three main types of masks: nasal pillow, nasal mask, and full face mask, which includes oronasal over the mouth and nose, as well as a total face mask, which goes over the entire face. We will go over the different parts of the mask. A mask generally consists of 3 or 4 parts. These include the mask cushion. This is the piece that applies directly over the face. The headgear is next. It secures the mask to the face, and the frame connects the cushion and the headgear. So I will start with the cushion into the frame. The headgear into the frame. And then the tubing connector to the cushion. This includes the exhalation port. Similarly, the oronasal mask also comes with multiple components. The cushion attaches to the frame with a hard push. The headgear attaches to the frame as well. Magnets below, and Velcro above. Some masks have clips where these magnets are. You don't want to use a magnet if you have a medical implant made of metal. And the elbow piece, which includes the safety valve. The elbow fits in to the mask with exhalation ports all around. Some masks have an alternate cushion for comfort's sake. This cushion comes with a standard silicone. I'll remove the headgear so you can see it better. And it can be alternated with a foam cushion. Pull it off. This mask brand is already using its alternate cushion type, a gel cushion, which can pop off and be replaced with the standard silicone, just like the other mask. A well-fitting mask should fit snugly on the face, but not too tight. We want to ensure that there is no air leak around the mask. Sliding it down. Touching the sides. And now Velcroing such that you can fit 2 fingers in to ensure it's not too tight. The strap should go under the ear and above the ear. The mask should also be able to be pulled away from the face and reset if need be. It can be a bit fussy the first time to ensure a good fit. And subsequently, you can just unhook each day. And you've got a perfect fit each time. All masks should have an intentional leak. This is usually found at the elbow of the mask. I'm going to point some out for you. This one is underneath a sound dampener. Here. here, and here. Please ensure that you feel airflow through these ports when the therapy is on. If the ports are blocked, then it's difficult for your child to breathe out. You'll need to ensure that you clean the ports very carefully, maybe with a toothbrush after cleaning to ensure soap residue doesn't dry inside. We recommend you keep an extra mask as a backup. If there's no intentional leak in your mask, you may need an adapter with a leak. Please speak to your medical team to ensure the mask has an appropriate intentional leak.
Full face masks have a safety valve since they cover the nose and the mouth. When the therapy is turned on, the safety valve goes up and seals. When the therapy is turned off, the valve falls down and you can breathe through this hole here.